Good afternoon, teacher. I will tell you a topic, nasal deformity in granulomatosis with polyangiitis. First, the definition. A nasal deformity is an abnormality in the structure and appearance of the nose that results in difficulty breathing, impaired sense of smell, and other concerns. Patients with a nasal deformity may also be prone to snoring and noisy breathing, nosebleed, dry mouth, chronic sinusitis, that means inflammation of the sinus passages, and sinus infections. Another definition is about granulomatosis with polyangiitis. It's a rare disease of uncertain cause that can affect people of all ages. It is characterized by inflammation in various tissues, including blood vessels, but primarily parts of the respiratory tract and the kidneys.
Diagnose it and how we can treat it. So GPA is also known as Wegener's granulomatosis, and it is an ANCA-associated small vessel vasculitis. So it affects the small vessels, and it is vasculitis, itis meaning inflammation, so inflammation of the small vessels. And it actually causes what we call necrotizing granulomatous vasculitis. It is actually more likely to be C ANCA positive. So again, this is an ANCA-associated vasculitis, but it's more likely to be C ANCA.
Applications in medicine. Physical examination show a subtle nose deformity with inflamed nasal mucosa and nasal crusting. Auscultation of the lung was notable for whistles and rales in both lungs. A computer tomography, a scan of the chest showed multiple pulmonary nodules, and a computer tomography scan on the face showed extensive destruction of the structural bones of the midface that had resulted in the formation of a large nasal cavity.
Issues with rhinosinusitis, and they can also have issues with recurrent acute otitis media.
Pros. A good treatment usually includes a combination of multiple medications. These medications typically include glucocorticoids such as prednisone and immunosuppressive drugs such as rituximab. If this treatment is taken in a good way, probably the patient doesn't have granulomatosis with polyangiitis for a while. Cons. The exact cause of granulomatosis with polyangiitis is unknown, but it is a type of autoimmune disease. For this reason, when this disease appears, most of the patients don't know how to do, and for that, the ill gets worse.
Include the non-specific arthralgia, fevers, cough, weight loss. Then you have granulomatosis with polyangiitis triad involving the upper and lower respiratory tracts and kidneys. Upper respiratory tract findings are often severe and include paranasal sinus pain and drainage, and purulent or bloody nasal discharge. Nasal septal perforation may follow, leading to saddle nose deformity, a buzzword to remember. Serous otitis media may occur as a result of eustachian tube blockage. Subglottic tracheal stenosis resulting from active disease or scarring can occur. From these findings, it is evident that the upper airway
Issue applied in Ecuador. The main problem is that since the specific cause of this disease is not yet known, it is being treated in a way that does not decrease nasal deformity, but on the contrary, even its condition becoming more serious.
Disorder for suspected ANCA-associated vasculitis include the ANCA, the actual anti-neutrophilic cytoplasmic antibody, full blood count, EUCs, ESR and CRP to assess inflammation, urinary casts for glomerulonephritis, a chest X-ray or CT chest to look for lower respiratory tract involvement as mentioned. More than 95% of patients are ANCA positive and majority of antibodies are direct.
To conclude this exposition, according to the treatment for a patient, a diagnosis of a granulomatosis with a polyangiitis was made, and immunosuppression was initiated for treatment of this ANCA-associated vasculitis. At 6 months of follow-up, the patient's symptoms have abated. Repeat CT imaging show resolution of lung nodules and stable facial findings. Thank you, teacher.